The world held its breath for over 2 years, grappling with an unprecedented crisis that brought life to a standstill. Streets were deserted, businesses shuttered, and the hum of daily life was replaced by an eerie silence. As we battled the COVID-19 pandemic, healthcare workers became our frontline heroes, donning protective gear and working tirelessly to save lives. Hospitals were overwhelmed, and the global community united in a fight against an invisible enemy. Just as we are beginning to recover, a new threat emerges on the horizon, casting a shadow over our hard-won progress. The world watches with bated breath, hoping to avoid another catastrophe. Health experts are issuing a dire warning. Bird flu, or H5N1, could be the next pandemic. This virus, which has primarily affected birds, is now showing signs of becoming a significant threat to humans. This virus, typically found in birds, has jumped to humans before. The transmission from birds to humans is not new, but the potential for a more widespread outbreak is what concerns scientists the most. Now, with a new, more transmissible strain circulating, the risk is higher than ever. The mutation of the virus has made it more adept at spreading, raising alarms in the scientific community. This isn't just an avian problem, it's a human one. The interconnectedness of our world means that a virus that starts in birds can quickly become a global issue, affecting millions of people. While the virus primarily affects birds, its ability to infect humans is concerning. The symptoms in humans can be severe, and the mortality rate is alarmingly high. The speed at which this virus spreads among bird populations is alarming. Farms and wild bird populations are at risk, and the virus can easily cross borders, making containment a significant challenge. We must act now to prevent a global health crisis. Scientists and health officials are calling for increased surveillance, better biosecurity measures, and rapid response strategies to contain any outbreaks. Vaccination campaigns and public health initiatives are crucial in this fight. Just as we developed vaccines for COVID-19, efforts are underway to create effective vaccines against H5N1. International cooperation is essential. World leaders and health organizations must work together to share information, resources, and strategies to combat this looming threat. Research and development are at the forefront of our defense. Scientists are working around the clock to understand the virus better and develop treatments that can save lives. Community engagement and education are also vital. People need to be informed about the risks and the steps they can take to protect themselves and their communities. The world is more connected than ever, and a virus that starts in one corner of the globe can quickly spread to another. We must remain vigilant and proactive in our efforts to prevent another pandemic. Simple measures like social distancing, wearing masks, and maintaining good hygiene can go a long way in preventing the spread of the virus. These practices, learned during the COVID-19 pandemic, remain relevant. Data analysis and strategic planning are crucial. By understanding the patterns of the virus's spread, we can implement targeted measures to control outbreaks and protect vulnerable populations. In times of crisis, solidarity and support are our greatest strengths. By coming together as a global community, we can face this new threat with resilience and determination. There is hope on the horizon. With swift action, scientific innovation, and global cooperation, we can overcome this looming threat and build a healthier, more resilient world for future generations. The current bird flu outbreak is already having a devastating impact on U.S. farms. This highly contagious virus has spread rapidly, leaving a trail of destruction in its wake. Farmers are grappling with unprecedented challenges as they try to contain the outbreak and protect their livelihoods. Poultry farms are on high alert. Farmers are implementing stringent biosecurity measures to prevent the virus from infiltrating their flocks. These measures include disinfecting equipment, restricting farm access, and closely monitoring the health of their birds. Despite these efforts, the virus continues to spread, causing widespread panic and uncertainty. Millions of chickens and turkeys have been culled to stop the virus's spread. This drastic measure, while necessary to contain the outbreak, has led to significant losses for farmers. The emotional and financial toll of culling entire flocks is immense, leaving many farmers in a state of despair. The economic toll is staggering, with rising poultry and egg prices affecting consumers nationwide. Empty supermarket shelves and skyrocketing prices are becoming a common sight. Consumers are feeling the pinch as the cost of their favorite poultry products continues to climb, adding to the financial strain on households. The virus isn't limited to birds. it has the potential to affect other animals on the farm, posing a broader threat to the agricultural sector. Farmers are now faced with the daunting task of protecting not just their poultry, but all their livestock from this relentless virus. Recent reports suggest that the virus has jumped to cows in certain states. This alarming development has sent shockwaves through the farming community. Veterinarians are working tirelessly to diagnose and treat infected cows, but the situation remains dire. The spread to cows indicates the virus's ability to cross species barriers, raising the stakes even higher. This crossover to mammals raises concerns about the virus's adaptability. Scientists are racing against time to study the virus and understand its behavior. Research labs are buzzing with activity as experts analyze animal samples and work to develop effective countermeasures. The adaptability of the virus poses a significant challenge, as it could potentially mutate and become even more dangerous. The potential for the virus to mutate and infect other livestock is a real threat to our food supply chain. If the virus continues to spread unchecked, it could lead to severe disruptions in the availability of meat, dairy, and other essential products. The agricultural industry is on high alert, and the stakes have never been higher. Protecting our farms and ensuring the safety of our food supply is a top priority in this ongoing battle against the bird flu outbreak. While human cases are still relatively rare, the World Health Organization has reported a concerning number of infections. The virus, which was initially thought to be confined to avian species, has now made a worrying leap to humans. This shift has prompted global health authorities to issue urgent warnings and advisories. The WHO has been closely monitoring the situation, and their latest reports indicate a troubling trend. The virus is not only spreading among birds, but is also showing an increasing ability to infect humans. The virus has shown a high mortality rate in the limited human cases observed. Medical professionals are on high alert, working tirelessly to treat those infected and to prevent further spread. Hospitals are ramping up their preparedness, with ICU units being specially equipped to handle potential outbreaks. The high mortality rate is particularly alarming, as it suggests that the virus is not only highly infectious, but also deadly. Charts and data from recent studies highlight the severity of the situation, with a significant percentage of infected individuals succumbing to the illness. The first confirmed human death from this strain of bird flu in the US has been reported. This tragic event has sent shockwaves through the medical community and the general public. News outlets are covering the story extensively, emphasizing the need for heightened vigilance and preventive measures. The death marks a grim milestone in the ongoing battle against the virus, underscoring the urgent need for effective interventions and treatments. Public health officials are urging people to stay informed and to follow recommended guidelines to reduce the risk of infection. This death underscores the seriousness of the situation. Healthcare workers are deeply concerned, as they are on the front lines of this emerging crisis. Doctors and medical teams are engaging in urgent discussions to devise strategies for containment and treatment. The expressions on their faces reflect the gravity of the challenge they are facing. The medical community is calling for increased funding and resources to support research and response efforts. The situation is evolving rapidly, and there is a pressing need for coordinated action at both national and international levels. We can no longer afford to view this as just a threat to birds. The virus's ability to jump from birds to humans has significant implications for public health. Environments where humans and birds coexist are now potential hotspots for transmission. This cross-species transmission is a stark reminder of the interconnectedness of our ecosystems and the need for comprehensive surveillance. Efforts are being made to educate the public about the risks and to implement measures to minimize contact between humans and infected birds. The goal is to prevent further spread and to protect vulnerable populations. The virus's ability to infect humans, even if limited, is a cause for immediate concern. Scientists are working around the clock to understand the virus's behavior and to develop effective vaccines and treatments. Healthcare workers are donning protective gear to safeguard themselves while caring for patients. Illustrations and models of the virus's transmission pathways are being used to educate both the medical community and the public. The situation demands a proactive and informed response to mitigate the impact and to prevent a potential pandemic. The world is watching closely, and the actions taken now will determine the course of this unfolding crisis. The possibility of human-to-human transmission is the most significant concern. While the virus doesn't currently spread easily from person to person, this could change. Viruses constantly mutate, and a small change in H5N1 could make it easily transmissible between humans. Imagine a scenario where H5N1 becomes as contagious as the common cold, but as deadly as some previous influenza pandemics. This is not a far-fetched possibility. We must prepare for the worst while hoping for the best. This is not a drill, warns Dr. Peter Police, a leading virologist. We've seen this virus jump from birds to humans before, and we know it can be deadly. We need to be prepared for the possibility of a pandemic. Dr. Ab Osterhaus, another renowned virologist, echoes this sentiment. The situation is serious. We need to enhance biosecurity measures on farms, increase surveillance for the virus, and educate the public about the risks. Section 6. The government response. The U.S. government is beginning to take the threat seriously. The Centers for Disease Control and Prevention, or CDC, is closely monitoring the situation and working on developing a vaccine against H5N1. Surveillance efforts are being ramped up at airports and borders. However, more needs to be done. We need a coordinated global effort to stop this virus in its tracks. This includes sharing information, resources, and expertise. Section 7. Preventing another crisis. We cannot afford to be caught off guard as we were with COVID-19. The lessons learned from that pandemic must be applied now. Early detection, rapid response, and clear communication are crucial. We must invest in pandemic preparedness, including strengthening our healthcare system, developing new antiviral treatments, and ensuring an adequate supply of personal protective equipment. Section 8. A call to action. This is not a time for panic, but it is a time for action. We all have a role to play in preventing another pandemic. Stay informed about the latest developments. Practice good hygiene, such as frequent hand washing. Avoid contact with sick or dead birds. If you experience flu-like symptoms, seek medical attention immediately. Early diagnosis and treatment can make a difference. Section 9. A future uncertain. The future of this outbreak remains uncertain. We can only hope that the virus will be contained and that a human pandemic can be averted. However, hope is not a strategy. We must act now with urgency and determination. The health and well-being